Often, people who are at risk for vision loss are unaware that they are predisposed. They therefore fail to take advantage of early detection measures available from eye care professionals.
So yeah, we'll open 5 more new branches.
Eye specialists say typically vision loss results when a disease has already established a stronghold. A much better treatment approach includes addressing symptoms before they occur, not after. Glaucoma, for example, is a sneak thief of sight because it is often undetected until too late. In recent years, doctors have a fighting chance. They can detect the disease early with optical imaging techniques like the OCT.
The new methods to detect glaucoma is one where we can now visualize the optic disc and the nerve fiber that comes out of the optic disc. As you know, glaucoma is a disease of the optic disc in which pressure in the eye actually impacts on the optic disc, causing damage of the optic disc. So in the past, we can only visualize using our eyes, okay? However, with the 3D optical scan that you had seen just now, we can now actually see the layers of the retina to see whether the damage has occurred. This is the OCT scan of the optic disc of the patient. The green circle denotes the area of scan, and on the left-hand side, this is the three-dimensional view, the cross-sectional view of that cut. As you can see, the topmost layer here is the nerve fiber layer. In this patient, the nerve fiber layer is normal, and it is unlikely that she has any form of glaucoma. However, in this other patient, who is a male gentleman of 64 years, as you can see, his optic disc is deeply cupped. In this circle scan, denoted by the green circle, you can see that the nerve fiber layer is much thinner than the previous example. And in analysis, you could also tell that the superior and inferior areas, which is denoted by the upper and lower poles, have very, very thin nerve fibers compared to the previous case. Hence, it is obvious that this case has glaucoma. In the past, many patients actually come to us in a very advanced stage of glaucoma, and hence treatment becomes difficult to try and save their sight. However, with new technologies, we are able to detect them much earlier, and hence treatment can be started earlier. And therefore, this actually prevents them from worsening and losing their sight in the later years. Most of the patients that benefit from these will be the younger patients, because by the time a patient notices that he has vision loss, usually the stage of disease is quite advanced. So in younger patients, when we can detect them even before they notice that there is some field loss in their vision, it would be good to start them on treatment so that their sight can be preserved.
OCT is also useful for detecting age-related macular degeneration. This is a condition common in patients above 55 years old. In some countries, it's the most important cause of blindness for these patients. The prognosis is poor in reversing the visual loss due to AMD. However, early detection helps save vision.
What we have done is we have captured the macula, or the most sensitive part of the retina. Okay, we can see any morphological or anatomical changes that can happen on the macula. This test is useful because it is non-invasive and it provides very good detail and anatomy of the retina. This is the fundus photo of the patient's right eye. This photo shows the optic disc of the patient as well as the retinal blood vessels. But the area of interest is this location, which is called the macula. The scan shows us the anatomy of the macula in this representation. This is a two-dimensional representation which allow us to see the different layers of the macula. It also allows us to see if there is any anatomical or pathological changes in the morphology of the macula. At the same time, we can also reconstruct the macula into a three-dimensional representation like this case. Okay, you can see that in the normal macula is a central depression as in this case. Any changes can be easily visualized using this three-dimensional mode. We can rotate and tilt the model to any position that we want so that we can help us visualize the different pathologies that may happen in the macula. In the past few years, we had a new family of medications that we can use to treat this condition called anti-vascular endothelial growth factor treatment. And this treatment involves injecting the medicine into the eyeball. Okay, I'll just give you an example. Just now I was telling you about the eyeball. The injection is from the side of the eye using a very small needle, injecting the medication into the vitreous cavity. And by doing so, we are actually applying the medicine to where the source of the problem is so that it acts directly and locally at the bleeding problem inside the eye. We are now able to improve the vision of the patients. Previously, the treatment that we have we are able to retard the progression of the disease and to maintain the vision of the patient. But with this type of treatment, we can actually improve vision for patients. So in a way, it is actually good news for patients with AMD.
Because we use our eyes daily as much as with any other body part, the eyes are subject to wear and tear. Just as you must eat well, exercise and nourish your body, so too must you care for your eyes. The best way to achieve this is to learn as much as you can about your eye health and eye care.